The numbers of patients with multiple chronic conditions that require ongoing care and cannot be cured, make up as many as 30% of primary care patients age 40 and more than 2/3 of those over age 65. This is posing all sorts of problems for the medical community and the patients. Here to discuss is WSJ reporter Sumathi Reddy. Sumathi, great to see you.
Nice to see you.
What sorts of conditions are considered chronic?
So this really runs the gamut. It can be really serious things like cancer, HIV, and then high cholesterol, hypertension, things that you wouldn't even know.
And doctors say the numbers of patients, even younger patients with multiple chronic conditions, is on the rise. Is that right?
Yeah, I mean, traditionally you think of sort of the age 65 and up population always having, 3, 4, even 5 chronic conditions. But they say even those as young as 30 or 40 years old are increasingly getting more than one chronic condition.
Can they point to any causes for this?
I mean, I think a lot of these diseases are just rising in general. So you have things like obesity or cardiovascular disease or diabetes.
Right. And now, what are some of the communication problems? Because let's say one of these patients with multiple chronic conditions is seeing several specialists. How are those specialists communicating with each other?
I mean, this is the problem. I feel like a lot of patients feel like they end up being the ones who have to manage their own care. And often that can be the best way. It's either, the two options you have are either going with an integrated care system like Kaiser or Mayo Clinic, where all your specialists and doctors are in the same system. So like they're being alerted when a new medication is added or something like that, or managing your care yourself, or sort of anointing your primary care doctor or family physician to be your quarterback, so to speak.
Right. And what are the most sort of dangerous things you have to look out for? Conflicting medications, I'm assuming?
Yes. So medications is a big one, because anytime you go on a new medication or change a dosage, that could affect one of your chronic conditions. It could affect the medications, the side effects. It could affect so many different things. You don't know what's causing what, so you have to be very careful about it.
So in general, for most of these patients, there is not one doctor who's sort of expected to look over the entire chart.
I mean, a lot of people will say that it should be the primary care doctor, and as long as your primary care doctor knows that, they should be the one doing it, but ultimately it really is you.
Right. And I would imagine, especially when there are lots of specialists involved, that the primary care doctor is not necessarily up on all the details there.
Yeah. I mean, these doctors are so busy these days.
Absolutely. And so what are some of the programs being put in place to help alleviate some of this?
So Health and Human Services started a task force a few years ago, and they're implementing changes. And one of them is a curriculum that just came out a couple months ago for medical professionals, schools, undergraduate, basically people in training, to sort of make them aware of, okay, a huge percentage of the population has multiple chronic conditions. Here's how to sort of treat them, and this is what you should be looking out for.
And if you are worried about your own care, what should you do?
I think sort of managing it yourself, trying to find a specialist. Like if you're a cancer patient, maybe your oncologist is going to be your quarterback.
Right.
And that's the person who's going to sort of manage everything. Having a list of all your medications, an updated list, either on your phone, like in an app, there's apps that do that, or just in your wallet. Just pull it out every time you go to see a different doctor.
An app is a great idea. Keep everything organized.
They do exist. Yeah, there are some that
exist. Good to know. Sumathi Reddy, thank you so much for that.
Thanks for having me.